pray. Look at your neighbor and say, God will take care of you. Come on, tell somebody else, God will take care of you. Hey, come on. Yeah. Put your hands on. Come on, say, no need. Hey, no need to fret. For my God's never failed you yet. Just keep on trusting and believing in Him. There's nothing too hard. He can do anything. Come on, I need some more people. Come on here. Say, God will. Put your hands on. Take care of you. Yeah. He will. He will. Take care of you. Come on, say it again. Say, God will. Said I know it will. I believe He will. He will. He will. Take care of you. Come on, let's sing it again. No need to worry. Hey, no need to fret. Oh, hey. For my God. Never. Oh, come on. Hey. Just keep on trusting.
All right, good evening, LFCC family. We want to welcome you all to Fresh Word. If you haven't already, please do join us on Zoom. I got a really neat text message a couple hours ago with all the Zoom log on information. So if you got that, we do want to see LFCC members on Zoom. But if you're catching us on Facebook or YouTube, like, share, comment. We want to make sure that we're getting this out to everyone who's watching. I'm so excited about tonight. We're going to hear some really great things. We have a special guest continuing on in our Women's Month series. So I'll tell you a little bit about our special guest, but I want to give a moment again, like, share. If you've got that text message with the picture of the log on information for the Zoom, go ahead and share that photo, share that text with your friends, especially the ladies. You want to be here today. So go ahead and we'll give you just a few moments again to share that. And while you're doing that, I'm going to go ahead and introduce our speaker for the evening. We have none other than Dr. Tracy Thomas. I'm so excited to hear from her. She was actually born in Rochester, New York, but really grew up just around the corner in the Capitola community. So I think that's really cool. If you're not familiar, that's on the other side of Chairs, just before you get to Lloyd. So not far away at all. She comes from a big family, so you all know I love big families, and she holds a BS in physical therapy and a PhD in pharmaceutical sciences with an emphasis in cardiovascular pharmacology and toxicology from none other than the Florida Agricultural and Mechanical University. So she is a Rattler. So happy to have a Rattler with us tonight. And she also is a tenured professor at FAM, where she serves as the interim director of the Doctor of Physical Therapy program. So excited to hear from her from that perspective as well. One great accomplishment I have to mention is that not too long ago in 2019, she earned her Doctor of Physical Therapy from the College of St. Scholastica. And that degree made her the only African-American woman in the country to hold those dual credentials. So big kudos to her for doing that, paving the way for so many others. And then she's got a ton of other great things, service to her community, great accolades. Again, just really excited to hear from her perspective, but I couldn't overlook how she ends her biography, and it's with a Bible verse, and it's Psalms 46, verse 5, and it says, God is within her, she will not fail. God will help her at break of day. And I thought that was so good. I even looked it up. So I'm so excited again to hear from her. So without further ado, I'm going to welcome to our Fresh Word Bible study, Dr. Tracy Thomas.
Good evening, everyone. Good evening. And thank you all so much for having me. I'm excited to be here tonight. Is it possible that I can share my screen?
Yes, we can figure that out. You should have a share button.
I'm waiting for it to for them to give me sharing capabilities. Let's see here. Let me try it now. Okay, there we go. All right. Okay. Let's see here. Hopefully you all can see this.
Yes, we can. It looks great.
All right. Actually, let me get a better version of it here without the extra. Just give me 1 second here. It was with me and then it went away. It's what happens when the university decides to give you 2 monitors. Literally, where did it go? Okay, I'm not going to panic. Hold on here.
You're good. Take your time. Again, I'll just emphasize that if you have not already, please do like and share the broadcast. As we're getting set up here, you can either join us on Zoom if you have that information, or you can share the Facebook stream. So go ahead, like and share, please.
Okay, now let's see. Now I can see it. Now let me see if I can get it to where you all can see it. I just recently relocated to a different office in my building. And can you see my screen?
Not yet.
Okay. And they have given this little country girl dual monitors that are obviously driving me crazy. So let's see. Let's try it now. Let's try here and now.
Yes, something's coming up.
Okay. You can see all the extra background too, can't you?
No, we can't. We just see the PowerPoint.
Oh, okay. All right. I'm okay. Well, I'm going to go with it.
All
we
right.
thank God. Okay, here we go. Now let's just see if I can make this advance. All right. Okay. So tonight, I'm here to talk. This is 2022 and this is March. This is our National Women's Month, National Women's History, all of those great things. But what a great time for us to just take some time to think about our health. And as it was said in my bio, I am a physical therapist, but I am a teacher by profession. I'm a research scientist as well. I take a great interest. My research interest in physical therapy deals with the health disparities that are often seen in the underserved and minority populations. And so tonight I want to talk about some of the biggies that we ladies have to deal with. Granted, yes, men, you have to deal with these as well. But for us women, it's a little bit different. Heart disease, diabetes, breast cancer, and then a general topic that I'm just going to call down below. Okay. I have a tendency to talk fast. I have a lot of information I want to share. That way, I'm hoping that we can have a discussion after we get through some of the information. So exactly what is heart disease? We often think about heart disease as a man's disease. We don't think about it as something for women, but heart disease happens to be the #1 cause of death for women in the United States. Heart disease has its undergrounding or its lining in what we say is cardiovascular disease, and cardiovascular disease deals with any kind of issues that deal with the flow of our blood, be it in our vessels or in our hearts. And what happens is that we can develop something called atherosclerosis. Atherosclerosis is when we have an accumulation that we call a plaque, and the plaque will line itself in one of your vessels. Now, one of the things about this plaque, the plaque literally is a clot. And that clot, depending upon where it decides to settle in your body, will either cause you to have a heart attack or it will cause you to have a stroke. God is so intentional that your body literally is always fighting to survive. So believe it or not, your body is making and dissolving clots right now. When we are in this well-balanced state of what we call homeostasis, that's what the body does. Something comes up, the body takes care of it. We only start to see and have disease when something comes up and our body fails to address it, or whatever has come up has become too much for our body to address. Okay, so when we have a heart attack, just as we talk about that clot, if that clot finds itself in one of the vessels of the heart, we have a heart attack. Think of it like traffic, okay? When there's a bad accident, either on the interstate or even here in Tallahassee, it will completely stop the flow at times, and then you have to take a detour. The same thing happens in the heart. The difference, though, is that when there is that blockage, if blood supply, which is carrying your oxygen and the nutrients that your cell needs, when that supply is cut off from heart tissue, the tissue will become necrotic. It will literally start to die. And so this is a picture of what it looks like. If this is the clot floating around in one of our arteries that feeds into the heart, then what you actually see on this picture, this purple area, this is where there has been, quote unquote, an accident. And so,
Dr. Thomas, if
yes?
I could, we cannot see this wonderful picture you're describing. So I'm not sure if we can change the screen. We're only seeing the opening slide.
Okay, let's see. So you haven't seen any slides that I've shown you?
Unfortunately not.
Oh, wow. Okay, so, okay, let's see. I'm gonna stop this share.
If you want to, Dr. Thomas, if you can, we can take time because this is good information.
Okay,
all email right. It to me and I can do it from mine. If you want to email it to me real quick, I can. It won't take me but a minute to pull it up.
Okay. All right, let's see.
While she's doing that, Rosemary, can you maybe go over some of the announcements? Because I want us to see this is good information because she just said a whole lot that I didn't know. So.
Absolutely. All right, so let's see here.
While she's emailing that and we're getting that all set up, I did have 2 quick announcements. We do have our prayer. We've been doing Thursday prayer, and we're going to be in the sanctuary this Thursday at 6:30. So make sure that you join us. Last time we were in the sanctuary, it was such a great time to be in the house praying with each other. So again, 6:30 in the sanctuary. And then again on Sunday, we will be in the sanctuary for service. So those are the 2 announcements, prayer on Thursday, and then in the sanctuary for service on Sunday.
Just bear with us a few more minutes because this is great information.
I'm just over here having this whole conversation with myself. I'm so sorry.
We were with you. We just didn't see the picture of the heart. I was following. You said something though, while you're pulling that up, that God was so intentional. That really spoke to me because you oftentimes think that you never get clots until it's an issue, right?
Right.
That your body isn't, taking care of the small ones or what it can be.
Right.
So right.
Your body, the way that we are designed, and it sometimes it's a little difficult for me when I'm teaching because I know where my strength comes from, and I know my faith. Mm-hmm. And I often have students who may have a different faith system. Right. So I say to them, I'm not sure what your faith is, but what I know is, and one of the things I know is that we are so divinely made that we are designed, God has made us that we want to live. Mm-hmm. Want to live. I don't know how many of you have children. I don't have any, but I love them. But kids have a tendency when they don't get their way, they'll want to throw a little tantrum, right? Mm-hmm. And they'll pout, and it's like, I'm just going to hold my breath and blah, da, 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 da. And as a parent, what you should say is, okay, go ahead. because it's physically impossible for you to suffocate yourself by holding your breath. Your
Wow.
body says, guess what? Breathe, period.
Yeah.
You know, you just can't do it. Did the presentation come through to you?
Yes, I'm
Okay.
opening it up
All
now.
right.
I will let you know. Give me about 2 minutes and I think we will
Okay.
be ready to roll. No,
Awesome.
you are A-okay. This is all good.
Okay.
That's
I'm so sorry.
that is a good point, though. Your body will say breathe.
Your body's going to say breathe.
Yeah.
It's going to say breathe. It is just designed to want to live, and it will fight to live. It will fight to live. We as stewards just have to be better stewards to make sure that we're giving it what it needs in order to put up a good fight.
I had another question while Julia's pulling this up. You mentioned that heart disease was the #1 cause of death for women in the US.
Yes.
And I was thinking, I always thought it was breast cancer. Can you speak
Number
to
2.
why? Okay, that's #2. So why
Mhm.
why don't we acknowledge heart disease for women?
Well, okay, that's an excellent question. So this gets into the disparities, right? We as a people who have melanin, we often go unreported. We don't often want to participate in clinical trials and experiments, but historically, we know why. If we have a government who said it was okay to not treat men with syphilis just to see what syphilis was going to do to their bodies, we haven't forgotten what happened in Tuskegee.
Right.
We as a people, we haven't forgotten what happened to the cervix of Henrietta Lacks. So we are a little bit more apprehensive to participating and getting the research and the numbers. But when science now looks at those numbers, heart disease remains the #1 because it includes men and women. But heart disease is also the #1 killer of women of color.
Wow.
And breast cancer is #2. Breast cancer is #2. And that is because we are getting better, but we still don't want to go and get, we don't want to get those mammograms. And I've got a slide in here about that as well.
Okay.
Okay, so there we go. Keep going for me. All right, and now you should have, there we go. There's the picture. Everyone can see the picture now? Yay. Okay, so the purple on the picture is the result of where no blood was actually able to get to what we call in this picture, the apex of the heart, meaning the very bottom of the heart. And it's part of the strongest part of the heart, which leads into the left side of the heart that actually causes the blood to flush through the heart and go out into the rest of your body. Okay. All right. So next slide. Okay. So this is the most common kind of stroke. There are 2 kinds of stroke. An ischemic kind of stroke means that there has been a block in the brain. Okay. So it's going to sound a little morbid, but if we were to take someone's brain out and hold it in our hand and turn it upside down, we would see the major vessels that feed the brain. And it's called the circle of Willis. Okay. When we have a blockage, same kind of blockage that was in the heart, when we have that kind of blockage in the brain, it is what we call an ischemic stroke, meaning that part of the brain is now without oxygen and nutrients. And so that part of the brain will start to die. What science has done for us, though, is that when someone is believed to be having an ischemic stroke, a lot of emergency rooms have something called what they call a stroke kit, which are drugs that are designed to quickly go in and dissolve that stroke. If it's been noted, the person has been showing these symptoms for about 30 minutes to an hour. And those are kinases. So they go in and they help kind of break up and hopefully dissolve the stroke. Okay. So far we've talked about when we have a clot. If the clot is in our heart, we have a heart attack. Simply put, that's what it is. If it is a sizable clot, but blood can still get around, some of that tissue is still going to die. So that's why you have people who have mild heart attacks as opposed to someone who's had a massive heart attack. Okay. there's a vessel that surrounds the heart that goes down the left side. And the left side, I told you, is the main pumping part of the heart. If we get a big enough clot in that, we call that vessel the widowmaker, because usually that person is going to have a massive heart attack and die. Okay, so if you go to the next slide, I want to show you the two different kinds of strokes. On the right is the stroke that I just described. If you look in the vessel right here, you can see this is the clot. It's kind of got some other stuff here along with the clot of the vessel, and now the blood can't get through. The other type of, in the picture below, you'll see this bluish gray area that indicates that that part of the brain is dead. So whatever that part of your brain was, causing your body to do whatever, it's no longer there, all right? The other kind of stroke that we can have, especially when our blood pressure is too high, and we're going to talk about blood pressure. When we think about blood pressure, I want you to think about a straw or water hose and water going through it. And some of you all might have the kind of garden hose like I have. It's all flat, and then when the water actually goes in, it fluffs up, right? But if I were to bend it, no water is going to go through. And if I'm really forcing the water out of the faucet, then I could possibly blow a hole in the hose and it would leak. This is what we call a hemorrhagic stroke. The pressure has become so great of the blood in the vessel that it will actually blow it out. And then you have bleeding on the brain. That bleeding on the brain, it pushes on brain tissue, and it too can cause brain cells to become necrotic. So thereby you also end up with some deficits, okay? So what can cause this pressure to be so great? Let's see the next slide. This good old thing called hypertension, high blood pressure, often called the silent killer, because we are walking around right now, many of us with high blood pressure, and we are ignoring the signs and the symptoms of our high blood pressure. Medically, we abbreviate it HTN, but we also call it BT, high blood pressure. And what happens is, again, think about the hose, the blood going through, and the force that it's putting on there. When you go and you get your blood pressure done or taken, or even if you don't do it at home, you get two numbers. You get a top number and a bottom number. And often when you go to the doctor, that's what they want to know. What was your top number? But what they really want to know, what was your bottom number? The top number is the amount of pressure that the blood is pushing on your vessels when your heart squeezes and contracts, okay? All right, so we would expect that number to be higher. The bottom number is the pressure that's still there when your heart is supposed to be relaxed. We don't want that number to be too high, okay? So often when you see a high diastolic number, then that causes rise for great concern. So let's take a look at the values. Let's go to the next slide. Go ahead and keep clicking. Okay, so go back one. Normally, we look at blood pressure as the standard of 120/80, okay? But now, because we are that America where we all are a little hypertensive, they've given us some leeway. So they'll say, oh, if your top number is greater than 120 to 139, then you have pre-hypertension. And if your bottom number is 80 to 89, you have pre-hypertension. And if it's greater than 140/90, then that's when you really have high blood pressure. I say, Tracy says, just as there's no such thing as pre-pregnancy, we have to get out of the mindset of, oh, I have pre-hypertension or I have pre-diabetes, because what do we do with that? We allow ourselves more wiggle room and we say, well, you know what? My numbers were a little high this morning, but I'm gonna go ahead and eat this pork chop with the extra salt on it. And for the record, as a country girl growing up on a 40-acre farm with chickens and hogs, the pork is not really the bad thing. Pork is a very bland white meat. It's to make it taste good. That's where we get in trouble. So when pork has been processed to give it some taste, It's a lot of added sodium and other things. Those are the things that actually are detrimental to our blood pressure. So now, next slide. What can we do about heart disease? Well, heart disease, as I said, it is still the #1 killer. Good, stay right there. And what you need to also know is that 1 out of 7 deaths in the US, we're killing almost close to a half billion people a year. But this last bullet point, African Americans are at a greater risk than white Americans. There's a plethora of things that feed into this, okay? Some of it is genetics. Some of it's we're predisposed. Some of it is lifestyle, okay? Some of it we are bringing upon ourselves. And then give me one more click on this slide. There we go. Between the ages of 45 and 64, I fall in this range right here. 70% of African American men and 50% of African American women are at a greater risk for heart disease. And again, a lot of that has to deal with our lifestyle. Well, that's what we know about heart disease. Let's go to the next slide to see about what do we know about strokes, okay? All right, so someone in the United States has a stroke every 40 seconds. Yeah, okay, yeah. So these itty bitty, little bitty strokes that people are having right in front of us, they often go undetected. We call them TIAs. It stands for transient ischemic attack, mini stroke, little bitty, itty bitty stroke. But they are the precursors of the bigger stroke that is coming if things don't change for a person. Give me a couple of more bullet points. And there you go. African Americans are more impacted by stroke than any other racial group in the United States. So earlier I said, sometimes when there's an ischemic stroke that's caused by blockage, if the patient gets the kinase medications in time, then they might get more of their function returning back because that medication dissolves the stroke and now blood can flow again. However, I believe that part of the reason we're greater impacted is because oftentimes our strokes go undetected until they are too massive, okay? There are people that are literally living in these almost pre-stroke stages without any kind of intervention. And I am so glad that in 2022, we are, as a people, we're far better about going to the doctor than we were 5, 10, even 20 years ago. So now, what do we know about high blood pressure? Let's go to the next slide. All right, stay right here. We're talking about 86 million people. 86 million people with high blood pressure. And the greatest or the highest population, and it is growing, African Americans. I tried to put in bold at the very bottom here. We're looking at 45% for African American males and 46.3% for women of color. Those numbers are alarming. That literally says that if we had a room of 100 Black men, 45 of them have high blood pressure. And if we had a room of 100 Black women, that 46 of them have high blood pressure. So let's go to the next slide and see who's at risk. What makes us at risk? If you've got a close relative that has high blood pressure, like your mother or your father, you're at risk. If you have melanin in your DNA, African Americans, we are predisposed. If you are overweight or obese, and truth be told, that is greater than 50% of the population based upon the medical standards that we go by to declare somebody overweight and obese. If you live a sedentary lifestyle, if you're not active, and I'm not saying you've got to go out and do these merch workouts or these marathons and all that kind of stuff, but you do have to do some movement. If you drink, too much. Okay. And I emphasize this because I come from this large family where I have maybe 4 uncles that are ministers and an aunt. And so growing up, it's like, oh, you shouldn't drink and you shouldn't smoke. Okay. Well, the research tells us, and you all know the wine of old is a little different than the wine of today, but a little bit of the resveratrol that we get from the grapes in those wines has actually been shown to be cardioprotective. People with diabetes, this, you can stick a pin in this one. Cardiovascular disease and diabetes, they're like a marriage, especially in people of color. If you've got one, the other one is right around the corner waiting for you. That's why it's so important that you attack the one that you have, because the other one, they are like Jack and Jill going up the hill, waiting for you to just tumble down. Expectant mothers. When a woman is pregnant, it is literally the closest that she can come to be to death than other than being dead. Because that's why, we have to, of course, the Bible tells us to honor our mother and our father so that our days are going to be long. But mamas, you put your lives on the line every time you get pregnant and bring a child into the world. It is the greatest time that you can die. And when we talk about blood pressure, this is so unfortunate. In our community of African American women, we've been taught, you just suck it up and be tough. So we go to the hospital and we have our babies and we get sent home too early. Or we go to the hospital and we're told you're not in labor, and you go back home and your blood pressure is really rising, so that when you do deliver, the next thing you know, you have a AAA, an aortic aneurysm, and literally Black women are bleeding out after birthing children. That should not happen, but it happens, and it's so unfortunate. Also, women on birth control, not only does it increase the risk of hypertension, it also increases your risk to have a stroke. I remember when I was in physical therapy school, I did an internship at Health South, which is now Encompass. And I saw a young girl walking around the facility as a client. And I said to myself, God, I'm looking at her legs, like, I don't see any incisions. What kind of surgery she had? She'd had a stroke secondary to birth control pills. Childhood friend of mine had a mild stroke secondary to birth control pills. One of my first cousins, a year younger than me, had a stroke secondary to birth control pills. And so we, as African American women who are more than likely a little predisposed already because our genetics, we have to be very careful about the use of oral contraceptives, because it can increase your risk for stroke and or a heart attack. So go to the next slide and let's talk about hereditary. I had to put this statement in here. She get it from a mama. She get it from the mama, because we are genetically 50% of your mother and you are 50% of your dad. And if they have a gene, they have blessed you and given you that same gene. Sometimes though, these genes require activation. I will give you an example. My biological father is deceased. I know from his family that he had some cardiovascular issues. My mother has mild hypertension. My grandmother died from congestive heart failure. 3 of my aunts have hypertensive heart disease. Tracy is predisposed. Tracy has very low blood pressure because Tracy tries to be very, very careful not to turn the gene on, if that makes any sense. Once it's turned on, then it takes even more effort to make sure that it doesn't cause anything else to go wrong in my body. Next slide. So what can we do Well, we need to reach healthy weights. And a healthy weight does not mean you have to be stick thin, okay? A healthy weight, it's going to be variable, but a healthy weight should also be something that's realistic for you. God made all of us individually different. So we all can't be a size 8, okay? But God didn't mean for us all to be a size 38 either, right? So you have to decide, and you're living in your body. Your body does a miraculous thing called accommodation. It will accommodate to whatever you're doing for it. I'm gonna give you an example. You start to eat something, hint, hint, nudge, nudge, and you didn't notice the salt content. You wake up in the morning and you have a headache. That's your body telling you something ain't quite right. But when your body starts to ease up because you give it water to help dilute it, you start to feel better. But tonight comes and now you eat something again that might have more salt. And your body's kind of like, now, wait a minute, Trey, didn't I give you a headache this morning? And then finally, your body starts saying, you know what? She wants me to have that amount of salt. So guess what? Let me just stop giving her the sign of a headache. Now my body's thinking, oh, well, that salt is fine. So my body has accommodated to having that extra salt. That's how we get in trouble with high blood pressure being the silent killer, because we get used to feeling blah, right? But your body is telling you, I don't feel good. We ain't listening, okay? I know I'm only going to talk about myself right now. In the days of, just like yesterday when I was speaking at a church, in the days when I was still clubbing real hard, okay? And this might not be your testimony. And you might have had one drink too many and you got sick, but it didn't stop you from drinking. Your body is telling you, you know what? This alcohol, sis, this is not it. This is too much for me. But what do? We turn around and well, it's a different day. It's a different party. It's a different drink. Yeah. Okay. So we need to limit our alcohol. We need to be physically active within what is safe for our body. We need to take the medication that has been prescribed for us. When it comes to the management of high blood pressure, there are lots of meds out there. The first one the doctor's probably going to give you is going to be a diuretic, a water pill, in combination with something else to try to pull some of that fluid off your heart, pull some of the fluid out of your blood so that your heart is not working so hard. Then this is the other thing. You got to control your stress. You've got to control your stress. You got to control your stress. I am on the book with the faces, as I call it, and there is a meme that says, if it doesn't serve you, if it's not serving you, don't give it your energy. Okay, don't give it your energy. But we, as a people, we take on the weight of the world. Okay. The next bullet point, I hope that no one is a smoker, but smoking, I have asthma, so I've never been, But what smoking does, smoking makes your vessels hard. And when your vessels are hard, they can't stretch and shrink to allow the blood to either flow freely or to give it a little resistance. Right? So when you smoke, it becomes rigid, just like a straw. Okay. And so that's why we campaign that we should not smoke. And then the last bullet here is so important. You need to know your numbers. If you are predisposed or if you are feeling some kind of way, you need to keep a diary of your numbers. when you got up this morning, what was your blood pressure? In the middle of the day, what was your blood pressure? Did you start to feel like you had a headache after you had something? Check your blood pressure. The doctors are human like us. They need our help to help us, okay? So the more information that you can actually tell your doctor, that's going to be better for you. The other thing we want to do, go to the next slide. This healthy eating thing is so important. You need to eat more grains and beans, definitely more fruits and vegetables. Be careful if you are diabetic, because you don't need to eat a lot of sugary vegetables. You want to eat, fruits. You want to have the fruits that are lower on the glycemic scale, like the berries, okay, as opposed to grapes. Y'all, grapes are so sweet. Oh, they are so sweet, but they are so good. So, but you want to limit, because if not, you will possibly activate the friend of heart disease around the corner, diabetes, because it's waiting. Having more lean meats. I grew up in the country, so I can't be vegan. I've got to have meat. But I try to have lean cuts of pork that's not oversalted, and beef, and chicken, and fish. Healthier oils and fats, healthier. So growing up in Capitola, I might be the only person that eats avocados on a regular basis, but I know it's a healthy oil and fat, and I really like it, okay? And then you have to limit those things, the processed foods. I'm so glad it's warming up now, because this is the time to start eating more salads and having more green smoothies, right? Pull some of the sugar out of your diet. Drink your coffee black. I see y'all shaking your heads. Drink your coffee black, because part of the problem is some of us like a little coffee with our sugar. Yeah, okay. Well, sugar is a drug. Your brain detects sugar the same way it detects cocaine, and you can become addicted to it, okay? Remember portion sizes. I am not gonna lie to y'all. Every once in a while, I want a McDonald's French fry. I do. Hot fries right out of the grease, but I get the small size. Don't let the people supersize you. Don't let them do it. Let's go to the next slide. So you got to learn how to create a healthy plate, okay? And so what we're going to do is, I believe I have a picture of one, but the way that a healthy plate is going to look, you're literally going to divide it up into fours, right? And on one side, which a fourth and a fourth would be a half, you're going to want mostly, that's where you're going to have some fruits and more of your grains, okay? You want to have a serving of meat in a fourth of your plate. And then you also want to reserve the last fourth for your grains, okay? So let's look at the next slide and we can see what a plate looks like. There we go. All right. So minimize here. We've got some fruits, y'all. You see the watermelon cutting across here? This is the season. Watermelon is so good, but watermelon, as watery as it tastes, watermelon has a lot of sugar in it, okay? Watermelon has a lot of sugar. You'll do good to have kiwi and blueberries. Publix is going to hit you over the head with the price, but it's better for you. You got to invest that money in yourself, okay? All right, let's look at the next slide. Talking about sugar being sugar being a drug. A teaspoon of sugar is 5 grams. I see you, Sister Rosemary. I don't know about you all. I used to drink soda. So at one point in my life, I weighed 264.5 pounds and I lost about 112 pounds. I've gained some back and I'm working to get it off again. But a soda, look how much sugar is in your soda, right? And y'all, if you have children, go to your kids' schools and look at the vending machines. These are the things that are in there, okay? Sodas and juices. We also like to think, oh, but juice is natural. Fruit is full of sugar. Sugar, I don't care if it's glucose, sucrose, fructose, corn syrup, it's sugar. Your body just knows that it's sugar. So it's going to treat it the same. So we have to be careful about the amount of sugar that we put in our body. The next slide, we need to get physical. You need to find an activity that you know you can do. Find an activity that you're going to stick with. Find an activity that is challenging. The best activity for me, walking. It's free. All you got to do is get you some decent shoes, okay? And you want to walk about 30 minutes. You should be walking at a pace. Now, I go to the park and folks be on the phone walking, nice workout gear. Their heart is not challenged, okay? You should walk at a pace to where you can still hold a conversation, but it's not comfortable to do so. Start out slow. Go for 15 minutes. Add 5 more minutes each day that you go, okay? But make it a challenge until you're able to walk those 30 minutes up to 5 to 7 days a week. So you want to get physical, and Peloton is the big thing now. If that's your thing, do Peloton. But the key is to be consistent. The next slide. This is so important. You got to take your medication. You got to take your medication. You got to take your medication. I used to do home health physical therapy, and I would go to see our people, and where's your meds? And out comes the brown paper bag, and it's medicine that's from 4-5 years ago that they're still holding on to because, oh, and this is what sister so-and-so gave me, or cousin. Wait a minute. Your medicine is your medicine. Stop sharing medications. Don't do it, because medications can have interactions, and those interactions could kill you, okay? And don't give somebody your medicine. Girl, let me just give you a little bit of this. It made me feel all right. I'm sure you're going to be fine. Don't do it. And don't be afraid to speak up and let people know, that that's not the right thing to do. Next, I want to talk quickly. Control your stress and stop smoking. Anything that bothers y'all, if it ain't serving you, get it out your life. Smoking, and I put on here first hand, second hand, third hand. Usually people talk about first hand, second hand. First hand is when you're actually puffing. Second hand is I'm puffing and you sitting in my car. Third hand is I walk in your house and it smells like an ashtray. Okay. Me being in your house is just as detrimental as me actually smoking the cigarette. Now, the person who lives in the house, they can't smell it anymore. You know why? One, they burned out their nasal hairs. They've kind of altered their smelling. Two, their body has accommodated so they don't smell it, right? But I can smell someone who smokes a mile away. And nowadays, we have to be careful because we have all of these carcinogens that are found in cigarettes, okay? All right, next slide. So what's your weight? Lord, here we go. We got these BMI calculators that tell us if we're too big, too fat, and all this kind of stuff. And, I have a scale in my office. I have a scale in both of my bathrooms, because it's not that I am obsessed with it, but I try to take note. I take note sometimes too, if I've eaten certain foods, the next day, what does my weight look like? That's how I kind of know, yeah, it was the salt, because salt and water like to stay together. So that salt is going to make me bloated. When we're trying to decrease our weight, you want to lose no more than 10 to 20% of your weight. Crash diets ain't going to work for you, sis. It's going to come back with a vengeance, okay? So it's best to lose your weight slowly and sustainably in a fashion that you're going to be able to keep that weight off, okay? All right, this BMI chart. So I said earlier, go ahead and click here for us. The BMI chart, I said earlier that when more than likely, we all fall somewhere in this overweight to obese. Now, keep in mind, these charts were not really, the science is out there now saying, especially us, we're saying, wait a minute, These numbers were based on Karen and Jim. These are not our numbers. These are not our numbers, okay? But they do kind of give us an idea. We know that as a people, we are a little thicker in some areas. But now don't go around here talking about, well, you know, that's just baby fat I'm carrying when your child is now in middle school. Okay, don't do that. You got to stop doing that. You gotta be real with yourself. Let's go to the next one. So when we talk about this indication, go ahead and click for me. We talk about BMIs. We want a BMI that's going to be less than this 18.5, right? I'm sorry, between the 18.5 to 25, and that is what's considered normal. Anything over 30, we're overweight, and anything that is higher, these other ranges, we're considered to be obese. And what we say is, with obesity, which is technically a disease, we often see it with its other two best friends, its other two BFFs, heart disease and diabetes. Okay, so go ahead and click for me. Okay, all right. So what if you lose some of your weight? These are the great things that are going to happen. You're going to decrease your risk for heart disease. You'll lower your cholesterol, which means you might end up coming off of some of your blood pressure medication. Your joints, your knees are going to be so happy, and your hips and your back. All of those joints are what we call weight-bearing joints. They carry your weight. So if you take some of the weight off, they're going to be happy. When you lose 10 to 20%, you increase your lifespan, you decrease your risk for cancer. It helps to detox your body. You can avoid sleep apnea. Sleep apnea is when you're trying to sleep and you stop breathing. Yeah, just like that. And for some people, they have to go and do a sleep study, and they may stop breathing hundreds of times during the night. Also, losing weight is going to help with the decreased risk of diabetes, as well as reduce your risk for dementia. But what if you don't lose the weight? Give me a click. You're setting yourself up for these things. You're setting yourself up for diabetes, stroke, heart attack, chest pain, angina, heart failure, kidney disease, be it acute or chronic, and peripheral arterial disease. Okay, so it's important. You don't have to lose it all at one time, but you do want to get your numbers down. Okay, all right, so let's click here. I'm going to go faster, okay, because I've talked about diabetes a little bit already. But if you would just go ahead and click to that first slide and give me the bullet points real quick. Diabetes is when we got too much sugar in our blood. Back in the day, they literally would taste someone's blood. They would taste their urine, and they call it sweet urine to know, oh yeah, you got sugar. Now, I work with our people, and I could talk to a client. Do you have diabetes? No. You don't have anything wrong? Well, I got a touch of sugar. That's diabetes. What does it have? People, you will be thirsty. You will have to urinate more. You'll have an increased hunger. There are 3 types. Go ahead and click for me. There are 3 main types of diabetes, and it's type 1, type 2, and gestational. Type 1, go ahead and click. Type 1 is juvenile, usually seen in children. Type 2 in adult onset. The unfortunate thing is that nowadays, children are coming out of the womb with type 2 diabetes, y'all. Why? Because mama has been jacked up on sugar while she was pregnant. And she's passed that sugar, that love for it, onto her child. Gestational diabetes also could happen when the mom is pregnant. And what happens is she turns it on after she has her baby. Normally, we will go back. But at least 20% of women who have gestational diabetes, they go on to continue to have diabetes. So quickly, next slide, give you a little picture here. You've got these two hormones, glucagon and insulin, and basically they are regulating sugar in your body. So when it's too low, it says, hey, you know what? Send some glucagon so we can have some more sugar, because we need the sugar so that the body can work. When it's too high, we say, hey, send some insulin so we can bring it back down. Again, we're divinely made to work that way. Go ahead and click for me. The ways that we diagnose, everyone probably has gone and had to do a fasting blood glucose, but the other one is the A1C, which is when the doctors look at your blood over a period of 3 months, okay? And let's go to the next slide. We want our ranges to be between 80 to 115. That's what we consider to be excellent. If it's too low, we become a little woozy in the head. If it's too high, we become a little woozy in the head. We can go into what is known as diabetic coma, diabetic shock. Let's go to the next slide. As I mentioned before, you can go ahead and click here. Juvenile diabetes is commonly seen in children. Next slide. And type 2 diabetes is also known as onset. But again, we do have children that are coming out of the womb with this. Type 2 diabetes is best managed when someone has a healthy diet, like that maintenance of a healthy plate. And then the third type, of course, gestational. Go ahead and click for me. I think I got 2 cute little babies. So yeah, coming from the country, you know, my grandmother, we would get, you know, somebody has a baby, they got to bring the baby to my granny, and she, you know, feel the thighs and everything. And they say, oh, this baby's just fat and fine and blah, 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 blah. No, this baby has myoscromia, right? These babies are being set up coming out the womb too big already, okay? And that's something that we can actually control. Let's keep clicking here. So look at these numbers. Go ahead and click through this slide here, and we'll get to the bottom here, the cost. Stop right there. The cost of diabetes, $327 billion, okay? That's medication, that's procedures as well, because what also happens is that diabetes is going to have some long-term complications. Go to the next slide. Next slide. All right, here we go. Hold your stomachs. There we go. This gentleman here has had a stroke. You can see the drooping on his face. Go ahead and click again. Hold your stomachs. This is a diabetic foot ulcer. Yeah, and one more. Yeah, this is a microvascular disease in the eye. The blood pressure is so high that it's literally popping the vessels, right? So these are all complications that add into that $327 billion thing that diabetes causes. Now, let's talk about breast cancer. We're almost there, y'all. Go ahead. 1 out of 8 women, we put 8 women together, 1 of them will have breast cancer in her life. And we are seeing the numbers of breast cancer between the ages of 20 to 59, but it does appear in those that are younger as well as older. African Americans, 31%, among the women younger than 45, breast cancer incidence is higher in Black women than in white women. And breast cancer, it affects us more so disproportionately than any other cancer. That's more, as I said, go ahead and click, partly because we don't necessarily want to go to the doctor. In addition, our environments, oh my, the things that's on the market that get into us, skin lighteners. I got a boo-boo right now on my cheek, and I'm saying to myself, oh, I need to put something on that so that it can kind of blend in with the rest of my skin. A lot of the skin enhancers that we have mercury. That's a carcinogen. Hair relaxers, yeah, sodium hydroxide, ammonium diglycolate. Yeah, so the big thing is to go natural, or to decrease the amount of times that you're actually getting your hair relaxed. Fragrances, I don't know too many of us that don't want a little smell good every once in a while, but you know, we say you put it on your wrist and behind so it'll last on your pulse points. It's getting now you're safer to put it on your clothes and on your skin so that it's not directly. And you guys, acrylic nails, let me tell you, my allergies got bad and the doctor said, yeah, you can't do anything on your fingers. I was like, the devil is a lie. Surely the devil is a lie. I've just gotten to where I cannot. I've got to do natural nails to the point where my doctor told me, don't even wear nail polish, okay? But the long-term use of these things, Formaldehyde is a large component in the things that we use for our nails, and that is a carcinogen. So what can we do? Quickly go to the next slide. We can skip the toxic things that we put on our hair. There are times when I have time, I make my own shampoo. Try to avoid some of the those carcinogens that are in all of these things that we're using, and reduce the use of fragrances. But the most important thing that we can do, next slide, mammogram, okay? Mammogram once a year. A mammogram, it is a low dose X-ray picture. And the reason why breast cancer is the second killer for us is because of the myths. We're out here saying, well, you know, the mammograms really don't help. The mammograms are the best things that the doctors have right now, and they can do early detection before you can actually feel that lump. Okay. Yes, you should be doing your own screening every month. If you are a woman who's still menstruating, you should be checking your breast around the time that you're still having your menstrual cycles for feeling for anything that's abnormal. If you are in, well, I'm not going to go there. Okay. The other thing, people believe that the mammograms, that the radiation will actually cause cancer. Well, the radiation dose used, it's so low that that's not going to happen. There are people that believe that they're inaccurate. Well, nothing is perfect, but they are the absolute best thing that we have. And if you've gotten your mammograms within the last, I'm going to say 3 to 5 years, you now know we have the 3D that most of our insurances cover. Yeah. The other thing, mammograms are painful. Well, this is kind of subjective. Okay. This is one of them things. I have a cousin. She just cries. Me? I'm fine. Yeah. Oh, you're welcome. So it is subjective, right? But I also think that we have to go in with a positive attitude, that this difficult, uncomfortable pain that you might experience every bit of 5 minutes can let you live. And that's important. Okay, we're almost at the end here, y'all. Down below, incontinence, menopause, and dyspareunia. All right, so urinary incontinence. These 3 topics are very, very important to me. These were my interests when I first started in PT, but no one was really doing it around me. So I didn't really get to jump into it until almost 20 years later. We cough, we sneeze, we hiccup, we giggle, and we leak just a little bit. And we say to ourselves, oh, that's just natural. I'm getting old. No, it is not natural for us to go around here leaking. All right, y'all, ladies, men, y'all just bear with us. So we have to think about our pelvic floor muscles. They are muscles. They're no different than your biceps, triceps, or anything else. They just happen to be down below. They will benefit from strengthening, just like you go to the gym to lift weights, or if you just lift water bottles or whatever, your pelvic muscles, that squeezing and relaxing, squeezing and relaxing. You can also do the same thing, ladies, to help with incontinence when you go to the restroom. Flow and stop, flow and stop, flow and stop. Okay, that's a way to help train. If you are on the heavier side, losing weight, because that losing weight is going to take some of that pressure off of your bladder. But the most important thing here at the bottom, having a bladder diary. Okay. Now, when I worked in the nursing home, skilled nursing, it's like state law. It's like the rule. For people who can't get up and move about, they have to be turned every 2 hours. Okay. So literally train yourself. I'm going to the bathroom every 2 hours. Every 2 hours, I'm going to the bathroom. Okay. Okay. But keep a diary of such things. All right. Let's move on to menopause. Menopause happens when we can literally have a diary of 12 full months when we have not had a menstrual cycle. And because some of us flow really heavy, we want to, it's over. Well, yeah, it ain't really over, because your hormones change. And one of the ones that's really changing is FSH. That's your follicle stimulating hormone. Because it changes, your skin changes. Your vaginal secretions dry up. Okay. We as African American women, we are more prone to have fibroids. And so hot flashes, irritable, your bones start to thin, and you risk fall. You're scared to fall because you risk that you might end up with a broken bone. Okay. So there are lots of things that you can take. The SSRI, selective serotonin reuptake inhibitors, they're really drugs for mood, but they've been proven to help with menopause. There's some hormonal drugs that you can take, but when you are going to do hormone replacement, of course, this is something you're going to discuss with your doctor. You want to take the lowest possible dose for the shortest amount of time, because hormones can have effects on your body. And then, of course, there are a lot of natural dietary supplements that are out there. Again, I would still, although they're not FDA regulated, I would still talk to my doctor about those. And then the last topic here. This is painful intercourse. Okay. Painful intercourse. It can be because of menopause. It can be because of fibroids. It can be because of the presence of endometriosis. It can be because of musculoskeletal tightness or laxity. Again, remember I told you the pelvic floor is just muscle. It's muscle. Well, if those muscles are too tight, everyone has probably had a cramp before, right? That cramp hurts, doesn't it? Yeah. Your pelvic floor can get tight like that. And so for a woman who wants to engage in intercourse, it becomes very difficult and very painful. I work with the PT who shared with me, she had a client who on her wedding night, she had sex with her husband for the first time. It was so painful. She was done. She was done. Okay. And so after, I want to say it was almost a year, she decided to go see a physical therapist. And she saw the therapist who helped her release some of this tightness with her pelvic floor muscle. As a result, she's grocery shopping one day and she sees her patient, but she sees the husband too, and she really doesn't know the husband. And so, when you're in healthcare, you don't really talk to patients outside of, okay. So she said she felt a little nervous. And then when the patient saw her, she's like, "Hi, how are you doing?" And the therapist is like, "I'm fine." And so the patient introduced the husband, and the husband's like, "Hi, how are you?" And then the patient said, "This is my physical therapist." The husband let go of the buggy and just hugged the therapist like, "Thank you." Okay, like, "Thank you." Because with PT, he was able to get a part of his wife back that he had not experienced in over a year. So this last slide is somewhat of an intimate slide, but we're talking about the use of dilators that you see in the corner on the left, and you can see they're graduated in size. They're designed to stretch. The picture in the middle is what we call a vaginal wand that is also used to stretch deep within the pelvic floor and to give relief and release. And then the bottom picture is electrical stimulation, because sometimes the muscles are just too lax and they need to be stimulated in order to actually tighten back up. Okay. And so now the final slide, I believe we are at the end. One more. There we go. Beloved, I wish above all things that you may as prosper and be in health, even as thy soul prosper. So that's what I have. I know it was a lot.
It was a lot of great information, though. I thank you so much. I really enjoyed every bit of it. I thank you for being just truthful and honest with us. There were some things that we needed to hear, right? Mm-hmm. And hopefully it kind of pricked our hearts a little bit. Last week we talked about mental health, and we talked about SMART goals. And I think we've definitely heard some things we can kind of pull on tonight and make some SMART goals. I know I have.
Yes.
So, thank you for that.
Yeah.
I didn't see Julia. I didn't see any questions come through.
There was one, is the 120/80 range for high blood pressure an acceptable number for African Americans, since heart disease is the number killer of Black women, and I would assume men as well?
Yeah. So see that, and that is why. So my mom's a nurse, and growing up, it was 120/80. Okay. Then all of a sudden, the folks started giving us this wiggle room. But I never steered away from the 120/80, because anything greater than that is putting us even at greater risk. Okay. The other side, though, too, is we don't want to be hypotensive, because if our blood pressure is too low, you stand up and you're going to fall out. So you want to kind of be around that 120/80 range to the best of your ability. Great question.
There are any other questions? We do have just a couple of moments. We can squeeze those in. I didn't have any questions. I had lots of notes, though.
Okay.
Lots of great things that I can definitely take. And I'm thankful that you talked a lot about the weight thing and the differences, because oftentimes I think as people of color, we think the numbers, the weight numbers, the blood pressure, all these numbers don't apply to us, because you mentioned they were from Karen and Jim. That's a real point, right? Because we kind of removed ourselves from the responsibility of actually taking hold of our health. And so thank you for mentioning that we can't just dismiss it.
Right. And so, a lot of the research that we have been living off of came from a Framingham study of people that did not look like us way back in the day. And part of that problem, though, is even today, we still don't really want to volunteer to get the information out. So I'm one of those, I'm a lab rat on both ends, especially with my asthma, because there are some medications that are approved on the market that they say will work better in African Americans. And when my doctor says that, sure, I'm here to try it. Let me tell you if it works better. Or when it comes to hypertension, probably some of the most used classifications of drugs are called beta blockers. Okay. Beta blockers don't work well in most African Americans, but most African Americans, when I look in their chart, they're on a beta blocker. Okay. So those little things that, we have to take note to.
I had one question. I know that most of us typically go to the doctor, or at least women go to the doctor for our annual exams, or how I know I go to the doctor. My doctor kind of has me doing blood work it was every 3 or 4 months, because I am anemic, highly anemic, and I have to get iron transfusion. So I have a hematologist as well.
Yep.
But how often, outside of just your regular, per se, woman, your annual exam, how often should you be getting blood work, or just to check it to make sure? Because some of these things, we may not always, some things, of course, you'll start to feel different, and that'll be your indicator, but sometimes you won't always feel different if you're, for say, pre-diabetic.
Right.
So how often would you recommend, even saying, I just want to make sure I get my blood work done, or things of that nature, would you recommend?
I'm for sure going to get it done at least once a year. But if I know that something's a little wacky off, then I'm calling my doctor. Now, I didn't say it, and I usually always do. It is so important that you have a relationship with your doctor. My doctors, I got two. I got an asthma doctor, and I have my primary. My doctors know me.
Yes.
I mean, they know me. They can walk in and they know me without looking in a chart. Okay. But part of the reason they know me is I made them know me. Okay. Because I tell my students even today, it's a partnership, me and the doctor. Now, unfortunately, my primary, she goes to my church, right? So I might be getting my praise on and see her, and I'll think of something, and after church, I'll catch her and say, hey, let me tell you, blah, da, 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 da. And she'll say, okay, you think you need to come in? Yeah. Okay. So that makes a difference too. With my asthma, I have what Dr. Saff calls life-threatening asthma. I have intrinsic and extrinsic, meaning sometimes I could laugh and have an asthma attack, or I could go into a room and the carpet will kill me today. I'll be fine tomorrow, right? So I have triggers that we don't know. So even with my asthma doctor, I don't feel well. Y'all remember when you used to have to go to your primary to get a thing to go to your, during that time, my asthma doctor said, we'll get with your primary later. You need to come now because you could die. And so I'm so thankful that insurances have changed to let us do that. But because I have a relationship with my doctor, he didn't take a chance on me. I had to go and live in South Dakota for 3 years when I was in grad school. And before I got there, he'd already had a doctor for me to say, you get sick, you go here. Okay. And so, yeah, having that relationship. And because I too am anemic, that you heard me say earlier, I got to have meat. Literally, Dr. Amanzi.
That's my doctor too.
Yes.
Yeah.
So I went to my primary. My primary's like, sister girl, your numbers are low. We're going to run these again. I'm like, okay. She's like, anything different? Mm-mm. But I forgot that I tried a vegan challenge for like a month and a half. Who knew? So she sends me to Dr. Amanzi, and Dr. Amanzi, she looks and she's like, girl, you going to fall out.
Right.
I'm like, oh, what's going on here? My low. So I had to have infusions. As a matter of fact, I'm going at the end of this month to get rechecked. But once I knew what was wrong, okay, it's a partnership. How are we going to fix it?
Right. And I would also say that it's also important that your doctors have each other's information too, because
Yes.
like you, I have a primary hematologist, I have another doctor, and I know my doctor is really big on the labs that my primary does. She always CCs my other doctors. Now,
yes,
carefully they look at them, but at least they have them in their records. So when I go to that appointment, I can say, you should be able to have this, and making sure that they're communicating with each other. And we have another question as well, but go ahead and speak to that.
And the good thing about that is we are kind of at that age when we can look out, but our elders are not. Okay. My mom, like I said, my mom's a nurse. My mother turned 76 in November last year. Well, July last year, we went in for her colonoscopy. We walked out with a cancer diagnosis. Okay. My mother had never been sick in the hospital other than having me. So, but to watch the health system try to fail my mom, and it was one of those things of just a lack of communication. So now she had her GI doctor who was leaving Tallahassee. She had to get an oncologist. She had to have a surgeon, and she had to have her primary and her cardiologist.
Right.
And so you moving in with me, okay? We going to these appointments together, right? So that I can get your doctors all the way together. As the students say to me, get them all the way together, Dr. Thomas, because this doctor has not taught that, oh, you had that done. And I'm saying, and why don't you know that? Why don't you know that? So I'm saying, I say this because so many of our elders, they don't know the questions to ask. Okay. And so we have to do better as a system. We really, really do. There was another question you said, I'm sorry.
Yeah, in the chat, somebody said that what should women that are older or still be getting pap smears? And if so, or what is the age when they can stop getting pap smears? So
I am not certain of the age to stop. I will be honest there. But if this is Tracy, I feel that if you have a history of cancer in your family, definitely continue to get your pap smears. I also feel that if you are still sexually active, you should get your pap smears. Okay.
Thank you.
Mm-hmm.
Any other questions? And I'm gonna turn it over to you, Rosemary.
All right. I don't see any other questions, but that was good information. I appreciate that.
Mm-hmm.
Definitely another goal for me, because I don't have a good relationship with my doctor, and that's my first goal. So build that relationship.
Yes.
Yes. All right. So I think we're good. I think I don't see any more questions. I just want to thank you again for giving all of that great knowledge. We really appreciate you. Thank
To
you.
God be the glory for the opportunity.
Yes, yes. Thank you. Thank you. And then I'm gonna go in. I'm gonna do the offering first. So we're gonna take an offering, and then I'm gonna go ahead and pray, pray us out for the night. So, Julie, if you have our right, we have our 3 ways to give that you'll see right there on the screen. Our online, our text to give, and our Cash App. We have a great giving plan here at Love and Faith. We really just ask that you be faithful in your tithe and be faithful in your offering. And we give a couple of suggested categories to do that. Whatever it is that you're able to give tonight. We also have what's called a high five. So maybe you're just catching our stream. You heard some great things tonight. You want to help support the ministry. You can Cash App us $5. That will help, again, make ministry mobile. So you'll see, again, those 3 ways to give right on the screen. I prefer to do the text to give. It's super easy, a one and done, set it up the first time, and then you can always go back and do that. So thank you again for supporting this ministry, supporting Love and Faith as we continue to do great things in this community. All right, so if you've given those or not, I'm going to go ahead and pray so we can go and have a great evening. I hope that you've got something really good from tonight, that you're able to take something and apply it to your life. I know I have a list of things. Number 1 being building a better relationship with my physician. But I'm going to go ahead and pray for us. Lord God, I just thank you so much. I thank you for information, God, that truly is life changing. God, it really comes at such a needed time, Lord, as we are coming off of pandemics where we're all concerned about our health. We're all taking a look at it just a little bit more. I pray, Lord God, that something that we heard tonight, Father God, would just move us to action, Lord, that we would be able to take care of our vessels, Lord God, of our bodies that you have gifted us with, Lord, that we would be able to correct things, Lord, that aren't supporting our bodily systems, Lord, that we will be able to start doing some things that will offer greater support. We thank you for creating us so perfectly, Lord. We learned tonight that you, Lord, were just perfect in your execution and your creation of us as humans, that our body wants us to be healthy, tries, Lord God. And I pray right now that you would just give us the strength, Father God, to assist our body in taking care of ourselves, to be able to manage our blood pressure, to manage our sugars, to be able to manage all of those bodily functions, Lord God. I pray that you would be with us as we sleep. Grant us good sleep, Lord God, as we go our separate ways. Your hand of protection upon us, Lord God. We thank you and we praise you, and we ask this all in Jesus' mighty name. Amen. Amen. All right. Thank you all. You guys have a good night.